Hello, nice to have you today. In this very exclusive, listen to me, exclusive edition of You and Your Health. You a mom? Or you have friends? You have someone pregnant? Please, listen to me. It is too tragic a thing for a woman to die in childbearing. It is so painful for a woman to labor for 9 months. Only at the point of delivery, that woman will lose the baby. It is too painful that what God said that the blessing of God make it rich and add no sorrow. Majority of people in the course of this blessing of God of getting pregnant, having children with all the joy expectation, only at the end of the day, the outcome becomes ugly. These and many more I will reveal to you. Why we should all stand together to save the lives of our women, most especially those that are pregnant, their baby, and also understand what to do about their well-being. Why not call their friends right now to tune into this station? The knowledge alone is enough. Do that. I'll be right back.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health, and as part of our vision 2025, improving Nigerian life expectancy from whatever not to be mentioned, it is right now to 70 years by 2025. We on course again and realizing that majority of death in our environment happen on the maternal level, which is too painful, traumatic as it were, and also those in under 5 mortality account for most of these deaths. And that's why I want us to see what a woman can pass through and may go without a baby. Sometimes her life can go with it. And today we're going to look at the issue of preventing maternal mortality and also their babies. If you know the pain of a woman having labored and carried pregnancy for 9 months, only at the point of delivery, she came out empty-handed, or with one story that she couldn't fathom the suffer of 9 months in combination with that. No, we can't be part of that. As a matter of fact, for those of us that used to prophesy to our pregnant women, you will deliver like a Hebrew woman. You should not go for cesarean section. This one should not be your portion. Please, can you hear me out? Whatever the issue, add this knowledge to the one you know. It may balance your prayers. It may also balance the way you approach this very woman and their condition. Now, let me let you know, there are 3 stages a pregnant woman will pass through in the course of pregnancy. And it was divided into 3. But so much to do, this time can't contain it. However, we're going to look at some critical ones that will be able to save just by just knowing what to do. There's what is called antepartum hemorrhage. Don't worry about the big grammar. The purpose of here is communicating this stuff in a way that a common man should appreciate it. Bleeding that occurs before 28 weeks of pregnancy is classified as antepartum, before labor. That's what it says. This is happening before labor. And you have 2 of them. You have the one that is called placenta previa. Let me just show you something about that. Okay, if you have a look at this, this is a baby right there in the womb, okay? And this is the placenta from which this very baby receives supply. This very segment of is where the baby come out. We call it the cervix, all right? And if I find this very baby seated this way, the baby, when the time comes, will use the head and come out, and gentle it is, and there's no problem. However, there could be an occasion which whatever could be responsible, instead of this very placenta being here, you may have this very placenta located in a different position. Now, unfortunately, towards the downside of where the baby will come out. That tells us something. This very woman at this early stage, intermittently, it may have vaginal bleeding. It may get to the hospital and say, now take a bed rest, okay? This very placenta at the early stage. Most of them, before 32 weeks, may migrate and shift away from this particular cervix. However, if this very placenta remain as a major degree, placenta previa, covering where this very baby should come, can somebody just by reason of common sense be able to know that there's no prophecy you should give to this woman to deliver from here? You will kill her. And these are the things that one will be saying, please go for cesarean section. As a matter of fact, this kind of a thing, they call it elective cesarean. The elective in the sense that it has already known and should be planned for. But somebody will say, no, you will not go for cesarean section. It's not your portion. You must deliver this. You will kill that woman because she will bleed to death. You will kill her baby. And at the end of the day, we carry it and say that it is the mother-in-law, the enemy, and all that. And we say, no, we can't continue again in this kind of error. And that's basically where we say, if there is a major degree placenta previa, it is an absolute indication for elective cesarean section. Now, having noted that, I want to show you something again. Now, look at this. There's one unique thing I want us to see. If you look at this very well, this is what is called pelvic bone. All right? Otherwise, we want to demonstrate here is bed canal. Bed canal is just like a drainage canal, okay? Which means a passage. All right? Where the baby normally come out from. They call it bed canal. All right? So, that very bed canal is as the baby usually come with the head usually gets engaged here. So you get a situation like this. You can appreciate that the baby is coming out, he enters that very womb. But I will tell you something regarding this. Now watch this. If you look at these two type of hip bone, you discover that this particular woman, the diameter between these two, look at what we call sacral promontories, you discover that the diameter here is wider. All right? What does it mean by being wider? It is roomy enough that the passage is bigger. For any woman or any baby coming there, they can pass. All right? Now, you have another one. This is what is seen in most women. And it is called gynecoid pelvis. All right? And then you have another one. This is the type I carry right now. Okay? It is called android pelvis. But there's something unique about this. Watch. We discovered that the diameter here is very small. Otherwise, it could be described as a contracted pelvis. No man can deliver the head of a baby because this sacral promontory narrows so much in men. Did you get that? So, unfortunately, lack of health information has not been able to make us realize the implication of this to women. You know what? In as much as most women tend to have this gynecoid pelvis, study has also shown that 25% of women do have this. Did you get that? 25% of women tend to have this particular type of pelvis. And what is the implication therefore? The implication is that by reason of this type of bed canal, will you say that this woman is not a woman? No. She can have a baby. Her baby can be delivered. But you know what happened here? If you now go to tell this woman that has this kind of pelvic, or whatever reason, maybe the head of the baby is big or the baby is big, there's a problem that is called cephalopelvic disproportion. Don't mind about this very big grammar, I will explain it. In Latin words, you have what is called cephalo. Cephalo means head. You hear doctors say a lot of things about cephalo, means head. And pelvic means this very bed canal we are talking about. And he said cephalopelvic disproportion, meaning that the head of this very baby, the head of the baby and the pelvic, they no match. They no match, meaning that the head will not be able to pass through that very place. And this is the commonest cause of cesarean section. Is the commonest cause. When the birth canal and the head of the baby, the two of them, the baby can pass. And someone will be in position to say to the woman, you must deliver. You must deliver. Some say like a Hebrew woman. Some say that if you don't go through labor, you are not a woman. And all manner of traditional narratives we have, just in effort to kill our women, going into a journey that's supposed to bring joy to the family. Ignorance is the mother of personal destruction, a voluntary misfortune. And it is worse when you are ignorant of your ignorance. Stay tuned. When I come back, I will tell you the danger that a woman subjected to this kind of situation, what that woman tends to suffer. I will tell you, and I will tell you why most times you see couples that are very intelligent, we deliver a baby and the baby is not doing well in school. I will give you that mystery. We help you to save that loved one of yours in that journey already. Stay tuned. I'll be right back.
Hello, I am Pastor Barrister Austin Nadi, the Country Director of Dr. Save Life Foundation. I'm inviting you to join this life-changing and destiny-reforming foundation today. You can be part of it by calling those numbers that are running on your screen right now, or visit our website on www.drsavelife.org. Together, we can save a life.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health, a program sponsored by Dr. Save Life Foundation, a non-governmental organization with a clear vision of giving total health to the people of Africa through the power of knowledge. We have a vision that by the year 2025, worry not about the year, we put a lot of things in place to make that happen, technologically and otherwise. And we share it that by the year 2025, Nigerian life expectancy will be 70 years and above. I just want you to join us even in getting the knowledge you are getting today. You share it with someone. Just sharing it with someone, you can save a life. Very, very important. I also encourage all the World Health bodies to watch out for Nigeria. 54 years life expectancy of Nigeria is not just only unacceptable, but I assure you, if speedy reversal of all the things that makes you to rate us that way, you will see them happen before 2025. Let's keep it like that. But this knowledge you are getting today is a journey in the positive direction. Now, we have been able to establish that we have the type of pelvic that a woman may have. Other small ones are still there, but enable the woman deliver. That if this woman have a contracted pelvic, or that the baby or that the head of that very baby is very big, invariably it will be difficult for this woman to achieve pregnancy. One of the things that actually give me this motivation, the passion to undertake this very task, happened to be an emotional experience of a woman almost 46 years who happened to have IVF after waiting for a decade of no pregnancy, and did IVF and eventually became pregnant. And that happened to be a baby boy. On the course of antenatal, it was found that she had a borderline pelvic, and the doctor looking at, number one, her age, number one, the precious nature of that very baby, in the state of a borderline pelvic, and advised and say, madam, you should go for cesarean section. She says, it's not my portion. I will deliver like a Hebrew woman. And while opting for issue of vaginal delivery, incidentally, labor was not progressing. She was appealed, but unfortunately, a man was calling him on phone. A man was calling her on phone by reason of what she said, being her pastor, and asking her, you will not go for CS. You will deliver like a Hebrew woman. It was such a serious situation that even the husband came and appealed to her, but he said that God will not put him to shame, that he will not take that God will not share his glory with anyone. Why we are doing all this now is to help you know how to pray. And what happened? All of a sudden, the heartbeat of a baby started going down, and eventually the baby died in her womb. Painful to tell you, that little one was taken back to the theater, opened up because of the size of the baby, and brought a dead baby and gave to her. The ignorance in our society, we can't allow to continue anymore. What you learn today, you will share it to all our clergymen and our religious leaders. Those that will be those that don't know the pain a woman passes through in pregnancy and in labor, let this understanding help them in saying, because at the end of the day, those that will die will be silent in the grave. Those that will lose their womb will not come to the altar to share testimony. They will be told that it's an attack. It was because of your mother-in-law, father-in-law. Enough of that. We have been fooled enough because of ignorance. Now, we are looking at this, and I said, if a woman has a pelvic that the baby can come out, let me tell you what will happen. That very labor is most likely to delay. Do you know what? Let me be very open, because you can hear some people say, I've labored for 2 days, I've labored for 3 days. I will tell you where that baby will end. Did you know that once active stage of labor is established from 4 cm upward, that woman is expected to deliver within 12 hours if that is her first pregnancy? Or if that particular woman, if he has delivered the baby before, like having a baby or multi-gravida, that woman is expected to deliver within 8 hours. But some people say, I've been laboring for 2 days. And doctor said, and at the end of the day, I deliver. Praise the Lord. I will tell you, majority of those testimonies are not complete because the brain of that most of those babies have already been compromised. When a woman had this Cephalopelvic disproportion, what will happen is, number one, that very baby may stay there and die. Second one, that very baby, if in any way be forced out, that very baby may not be able to breathe. That baby may not be able to cry. He may not be able, he will suffer what is called beta asphyxia. That's the story of it, is for another day. That very baby, having stayed a while in that very place, may have what is called meconium stain liquor. He may pull inside the womb in the course of forcing himself out. He may also get infected, so he's likely to suffer sepsis. And that very baby, if nothing is done, the sepsis, the infection become very high. It may lead to jaundice, and that may also lead to what is called kinniтерus. The brain of that baby may be useless. Very unfortunate. For this particular woman, when he's still there, push, you will deliver, push. On the course of the labor coming, that womb may burst. Pum! Too bad for me to tell you, if a woman has a ruptured uterus, that uterus is gone in most cases. If there be no immediate intervention, that woman can be bled to death. In the course of even fighting to save the uterus, sometimes the uterus will be removed in order to save the life of that woman. And you know what? Most of them start having infertility after that because of those complications. A woman was in labor and was told, look, you need to bring out this baby. The man said, no, my wife will deliver. I was encouraging the wife, push, you will make it. Eventually, the womb ruptured. On the effort to save the life of the woman, the womb was taken off. Over the time they stayed, problems start coming in the family. The woman now start accusing the man that being responsible for her woes. Now they are praying on the issue of God can recreate another uterus. You know, there's one thing they used to say, what God cannot do does not exist. We don't have to try him. We don't have to use out of ignorance and negligence, be in position to begin to pray on things that are preventable. So this very woman may suffer another thing is, if there be a situation, this head of this any baby stayed for a while, he may press the bladder against the sacral promontory. And when he presses the bladder against it, over the time, that after 2 weeks of delivery, that particular portion that was overpressed may open up. So you see the woman, it's very common also in the north, where you have what is called VVL, vesicovaginal fistula, where the woman will urinate and the urine will be passing from the bladder into the vagina and coming out. That thing can be repaired. If you have anybody suffering that, don't cast that woman out, it's not her fault. It's unfortunate. That thing can be repaired. VVF can be repaired. If you have such person right now, where that lady is, change this number. The foundation can assist that young girl. It's not her fault. It's an unfortunate situation we have found ourselves in our society. Do not abandon a woman because of VVF. It usually happens secondary to prolonged labor, usually in younger people, because over there they marry at a tender age. All right? So we are also looking at, because of this delay, that very baby also may have what is called birth asphyxia. Birth asphyxia is that baby will come out, he will not be able to initiate spontaneous breathing, may not be able to cry, he may not be able to breathe. And do you know what? If a baby that is born and within 10 minutes oxygen has not reached to the brain, that very brain will start dying. And by the reason of that very baby start dying, it will suffer what is called hypoxic ischemic encephalopathy. Don't worry about the big grammar. What that means that the oxygen is not reaching to the brain will start dying. And once that very brain start dying, that very baby may never remain the same again. Even the intelligence of that very baby may be affected. All these things are some of the things that can happen following ignorance of what a woman is passing through in the course of delivering her baby. Don't be party to kill our woman. Don't be a party to be in position to make them suffer this kind of experience. Traditional birth attendants also know when there is a need for you to move this very woman to the hospital. All right? With that effort, that woman will be in position to deliver and can still appreciate you. Everything is not money. Joy you give to someone else will surely bounce back to you directly or indirectly. Let us together save the life of our women, not to suffer because of ignorance. Stay tuned. I will be right back.
I'm more than 50, but God, in His mercy and grace, today I can breastfeed.
You and Your Health with Dr. Richard Okoye. Now on AIT. Every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health, a program sponsored by Dr. Save a Life Foundation. You can support this program in any station where you can find. We can give you details and join us together to save our women. You can also call on this very station. Whichever support, it will be highly appreciated, because the hour has come for light to prevail over darkness. Now, we are looking at what our women suffer, and there's one more thing because of our time, what is called pre-eclampsia, pregnancy-induced hypertension. All right? And this particular condition is quite classical, I want to tell you, and usually start from 20 weeks of pregnancy and above. And it is associated with increase in blood pressure, and also when there's protein found in the urine. All right, this is something that is very critical, that even if you are a traditional birth attendant, always do a simple test called urinalysis for your women. If you find sugar or you find anything like protein in that urine, please don't deliver them. Send them to a place where there is a facility to be able to deliver such people, because most times their baby end premature. Pre-eclampsia, unfortunately, is a progressive disease that sometimes you will do everything to control the BP. If the BP could not be controlled and protein is being found more in the urine, if you allow that woman, she will fit. And once she fit, some can fit once, some can fit twice, and they're gone. And that's why it is important that that woman is managed in a hospital with a facility that should be able to give all the necessary things. If the baby has reached up to 32 weeks and above, you can plan the delivery. But if the baby is less, dexamethasone can be given to mature the lungs of the baby and then prepare delivery by any possible means. If that happens, if the delivery happens, usually the BP will start coming down. Most times some people will say, no, allow, try. That's why they lose their wives. And I tell men, you cannot afford to lose your wife in pregnancy. The trauma of it you will never forget. Don't use because there is no money or you don't want to spend money, and a decision that should save your wife during childbirth, you will be turning it up turning it up until that woman goes. You may never forget it. You will never forget it, I tell you. So it's important we support our women in distress condition during pregnancy and during delivery. Interesting thing about this pre-eclampsia is that when it happened the first time, it is important. That's what is called pre-pregnancy counseling. And a nice guideline, National Institute of Healthcare Excellence England, is an evidence guideline and categorizes the women into two, called the major risk and also the moderate risk. And it is stated that if a woman is found to have chronic hypertension, chronic diabetes, or chronic kidney or renal problem, or something like autoimmune disease like systemic lupus erythematosus, that these women should be classified under major if any of this is found. And also the moderate risk group, you have the one if this woman is obese or having a family history of pre-eclampsia, or being in position of being the first time pregnancy primary gravida, or being in position of having multiple births, or have done IVF, which also associated with multiple births, or this woman is an elderly primary, it has already advanced in age, or the interpregnancy interval is very long. This woman has born, delivered, and then 10 years after another delivery. That very guideline says that if a woman is found with one of any of those major one, or found with the two of those other moderate one, that woman should be placed on vasopressor, which you have 75 milligrams here, but over there in the United States you have 150 milligrams. That woman should be placed on that one daily until delivery, starting from the 12 weeks of pregnancy. Then in most of the cases, it tends to avoid that very experience, or even if it happens, it doesn't happen as serious as otherwise. Because if that woman is fit on what is called eclampsia, that woman can die. For want of our time, this is much you will be able to take, but share this knowledge to everyone you know. You can get this very message in case you miss it out in our YouTube channel or Facebook channel or any of our social media. Join us to be able to pursue this cause. We are already winning. And come 2025, there will be a victory. God bless you as I see you again.